And away from COVID-19 pandemic, but still on health matters, the world seems to be running out of time to act on the commitment made by global leaders to end tuberculosis globally. This is the reason experts at an event ahead of the World Tuberculosis Day won the theme, "The clock is ticking," to push the need for urgency towards ending the disease. They used the moment to also warn Nigerians who come down with similar symptoms like that of COVID-19 to go for testing because it could just be tuberculosis. And TVC News' Kemi Balogun reports.
Tuberculosis remains one of the world's deadliest infectious diseases. In 2019, 10 million people contracted tuberculosis. More than 400,000 were infected with drug-resistant TB, and about 1.4 million died from this disease. The drive to end TB remains critical, but the emergence of the COVID-19 pandemic has slowed down progress made at ending TB. Experts here want more response shifted towards TB response and other highly infectious diseases. The funding gap remains the biggest challenge to achieving this response.
At the end of 2019, the funding gap for TB control in Nigeria is 70%. And for the 30% funds made available for TB control, it may interest you to note that international donor agencies, most especially USAID, provided 23% of the money used in controlling TB by the end of 2019. And I think for us to do more to meet the SDG target for TB control, all hands must be on deck. Government needs to increase their commitment.
The reason why the funding gap is also so high is because there's nothing to fall back on. We need to have peripheral health systems that the populace trusts, primary healthcare centers that people can walk into.
We have $384 million US funding gap. If you times it with the current exchange rate, that will give you the funding required to tame the scourge of tuberculosis in Nigeria.
The overall drive by the World Health Organization is to diagnose and treat 40 million people with TB, including 3.5 million children and 1.5 million people with drug-resistant TB, all by the year 2022.
Tuberculosis is a disease that can affect any organ in the body. Any organ in the body. Tuberculosis disease can affect even the reproductive organ, the womb. We have seen people that do not have that have infertility as a result of tuberculosis.
Since the emergence of the pandemic, many symptoms of tuberculosis are mistaken for COVID-19, and experts here want Nigerians to still go for testing when symptoms occur. Kemi Balogun, TVC News, Abuja.